What's going on, folks? We have a big show for you today. Bayer to pay $40 million in settlement after alleged kickbacks to hospitals' physicians. This happens all the time with Big Pharma, but the media usually softballs them, and then Big Tech acts like you can't challenge them. Why does it keep happening then if they're so ethical and so great? A $40 million in settlement after a kickback to hospital and physician scandal. We're going to talk about it. Also, I've been seeing people like Alex Berenson on Twitter talk about 8 mice when it comes to some of the tests that Pfizer's doing. So I looked it up, and sure enough, science.org in the article Omicron booster shots are coming with lots of questions. They said that Pfizer presented preliminary findings in 8 mice given BA4, BA5 vaccines as their third dose. 8 mice. Interesting. We already know NBC and Wall Street Journal are reporting that human testing is not done, yet they're emergency use authorized. But don't worry, folks. Instagram, Facebook, Google, YouTube, and everywhere you can see this stuff is probably going to put a nice little cute label that tells you how amazing everything is, not to question it, and to go to the quote-unquote experts in government and at World Health Organization. Let's see what happens. We'll talk about it. It's going to be a great show.
It's the Dream Rare Podcast. Welcome to the show. The way to get the news at the desk or on the road. Let's go. God is great and success in our control. The world is crazy, but we get better from obstacles. It's the Dream Rare Podcast. Welcome to the show. The way to get the news at the desk or on the road. Let's go. God is great and success in our control. The world is crazy, but we get better from obstacles. Yeah.
What's going on, everybody? Thank you so much for joining me today on a Saturday episode. I was going to take the day off, but I saw this article. My buddy sent it to me. Bayer to pay $40 million in settlement after alleged kickbacks to hospitals and physicians. So we're going to read that article aloud and see why they're paying $40 million. Fascinating stuff. And the second story I want to talk about, we already know if you follow my channel, this is NBC mainstream stuff. FDA expected to authorize new COVID boosters without data from tests in people. The lack of human data means officials likely won't know how much better the new shots are, if at all, under the fall booster campaign well underway. Wall Street Journal also reported this. Latest COVID boosters are set to roll out before human testing completed, so we already knew that. But what I kept seeing on Twitter from Alex Berenson and others was 8 mice, 8 mice. And I'm like, what is this narrative about 8 mice? So I found the reporting in science.org, and they're referencing a Pfizer data study with 8 mice in it, literally. So we're going to show proof of that as well. So that's the story of the day. First, let's start with this. Once again, Bayer to pay $40 million in settlements after alleged kickbacks to hospitals and physicians. No way, right? This can't happen in Big Pharma, right? There's no way because, Facebook tells me I'm not allowed to question them, and so does YouTube and Instagram, and they're all in on it, and they tell me to just check government websites and World Health Organization because they'll tell you how to think, and they'll tell you how safe and amazing and effective everything is. And, this just great industry just, is just ethical, and there's no reason to even consider questioning anything that they do now because there's an emergency, right? But we're going to read this article. Let's see. This is, as alleged in the complaints, Bayer, one of the world's largest pharmaceutical companies in the world, engaged in a series of unlawful acts, including paying kickbacks to doctors and hospitals, marketing them off-label, and downplaying their safety risks, U.S. Attorney Philip R. Selinger said in a statement. This resolution should send a message to the pharmaceutical industry that such conduct undermines the integrity of federal healthcare programs and jeopardizes patient safety. Bayer will pay $38.9 million to the federal government and $1.14 million to 20 states and Washington, D.C. That statement noted that Lori Simpson, a whistleblower in the case, will receive $11 million from the proceeds of the settlement. Simpson, a former employee of the company, alleged that Bayer had paid the kickbacks to persuade hospitals and doctors to use the drug Trazodone and Avalox and market them for off-label uses that were not reasonable or necessary. Simpson also said Bayer minimized the safety risks of Trazodone, a drug used to control blood loss during certain cardiac surgeries. The results, we could just keep reading, but anyway, long story short, Bayer, who now owns Monsanto, by the way, Monsanto and Bayer were massive companies. They merged recently and Bayer just swallowed them up. They just had to pay a $40 million lawsuit because a whistleblower apparently sued and did enough damage that they decided it was worth it. So, I know multiple people that work in the pharmacy industry. There's a whole It's crazy that this is even controversial now because people got so brainwashed, but they're the number one lobbyist in Washington, right? They pay off both parties. That's what they do. They lobby to gain influence, and then they get what they want. They lobbied Reagan and Congress in the 80s to get the National Childhood Vaccine Injury Act. And to this day, Pfizer and a lot of these big pharma companies pay lots of money to Republicans and Democrats to, of course, they're not doing it for their own best or, for no reason. They're trying to gain leverage. Same thing happens to influencers, athletes, etc. I know multiple people that either work directly or know people that work in the marketing for pharma. And what they do is basically just try to get people to do what they want. So there's things that I know that my friends who've worked in it are like, yeah, we just like party. We party with influencers, party with celebrities. That's our job. We go out, we party, what I'm saying, and try to get them to sell our product. And when it comes to doctors, I've even heard stories that they, basically like try to give them women and, all this sort of stuff where it's like, whatever you want, you want drinks, you want drugs, like we're your best friend, just, sell our product and push it to your audience. So it's not the most ethical industry in the world. Most people do sales and they're not above it. So interesting that they got caught right now because they're always getting caught. Pfizer got caught, Bayer just got, it's a thing that always happens, but these companies don't really care because usually the settlements are lower than what they made. So for an example, if you make $15 billion and you pay a couple $1 billion, that's a $10+ billion profit margin. They don't really care because no one ever gets held accountable. Not in the opioid scandal, not in the Pfizer scandal that happened a decade ago. No one ever seems to go to prison or, it doesn't matter how many people died or lied or got injured. It's just like pay a fine and just keep it moving. We'll show you not to do that again while the federal government, gives them a bunch of money for their other ventures. Sure. Yeah, you're really pushing this huge narrative. So second thing I want to talk about real quick, I just have to show this because I know there's these little fact checker gremlins. We talk about them all the time. They lurk and they just cover up for big pharma and big government, and they're just like little sneaky operatives that are just making humanity worse, and they pat themselves on the back and say, oh, I'm so good, I'm fact checking the world, but really what they're doing is covering up the truth. That's why 3 years in advance we're usually ahead of the schedule, and they cover it up. It's like, let's cover up the lab leak theory. Oh, now you could talk about it. Let's cover up forced masking and act like you can't oppose it. Okay, now you can. It's like they're always 2 years in advance because they're just doing the bidding of big government and big pharma. But let's hold this up because I don't even need to say it. NBC News, this is mainstream stuff. FDA is expected to authorize, which they did authorize, the new COVID boosters without data from tests in people. The lack of human data means officials likely won't know how much better the booster shots are, if at all. That's NBC. I didn't say that. They did. So I had to look into this article because I kept seeing it, and I'll just show you real quick. This is science.org, very credible organization. Omicron booster shots are coming with a lot of questions, right? In this article, I'm just going to hold it up so you guys can read it yourself so they can't accuse me of lying. It says right out of this article, for the BA4, BA5 boosters, the company have not submitted animal data. They have not released those data publicly, although at the June FDA meeting, Pfizer presented preliminary findings in 8 mice. Wow, 8 mice given a BA.4, BA.5 vaccines as their third dose. Compared with the mice that received the original vaccine as a booster, the animals showed an increased response to all the Omicron variants tested, BA1, BA2, BA2.12.1, BA.4, and BA.5. I thought people had to be exaggerating when they were like, yo, 8 mice, 8 mice, 8 mice. I'm like, I'm not somebody who's just going to report fake news or just buy into the hype of people who are criticizing big pharma. I get to the truth. So I had to look it up. I'm like, there's no way this is true. I mean, this is so sloppy. This is so pathetic. This is so ridiculous that this can't be true. But in mainstream headlines, it says they haven't released those data publicly for, animal data, but they have in June, Pfizer presented preliminary findings in 8 mice. Okay. And just to remind you, from the NBC News article, the human testing, it's not done yet, but don't worry. They have testing in 8 mice, and it's good because despite the fact that Big Pharma is constantly settling out lawsuits of getting caught fraud or bribing doctors or whatever they get caught doing every other year, it's like, things taken off the market, everything doesn't work out. They have products that are, that were approved that are taken off. This happens all the time. But, the reason that you could trust everything that Big Pharma does is because anytime you post anything that involves the word vaccine or Big Pharma or any of these keywords that AI algorithm, artificial intelligence are zapping, they let you know exactly what to believe. I mean, they'll send you to the World Health Organization website. They'll send you to the government website. There's going to be little sub things. Are you sure you want to think with your brain? Are you sure you want to ask questions? Or don't you just want to go to the government website? We're going to tell you how amazing everything is. Yeah, but are you going to tell people on that website that you don't have liability for side effects, and neither does Pfizer or Moderna? Are you going to explain the PrEP Act right on that website? Or are you just going to tell people how amazing it is while you're not taking liability for things that might happen, whether they're rare or not? They don't tell you that. Of course, they don't care. So that's what it is. But I'm going to read some of the article. I printed out 5 pages of it. So I'm not going to be too boring, but I want to find some interesting parts that I thought were interesting. One of them was the data, science.org. The data on the updated boosters are limited, however, and the impact of they will have if greenlit is unclear. Here are a few of the questions surrounding the vaccines. What do the new boosters contain? A bit of the old and a bit of the new. Both the Pfizer and biotech collaboration and Moderna make their vaccines with messenger RNA coding for the spike protein of SARS-CoV-2. The new vaccines are bivalent, whatever that means. Half of the mRNA codes for the spike protein are of the ancestral virus strain that emerged in Wuhan, China in late 2019, which is also in the original shots, and the other half of the code for the spike protein in BA.1 and the one in BA.4 and BA.5, which contain identical spikes, because they contain a lower dose of the mRNA shots and they're meant to be used for boosters only, not in people who are vaccinated. So since I wasn't originally vaccinated, I guess I'm not even supposed to get this according to this article. There's a lot of interesting stuff that's said in here. I don't want to bore people and ramble on for too long because I could read the whole article, which I did. But it's like you have doctors being like, questioning the fact in this article of like, why are they using the ancestral strain in the new one? There are people in the FDA in this article that I want to find this exact quote because it was very interesting. Here it is. This is somebody from the FDA. Let me try to find his name real quick before I read it aloud. There's a guy that worked at the FDA, who said this. I highlighted it. He said, even if 100% of the population were vaccinated and the virus hadn't evolved at all, vaccines would do very little to stop transmission, right? That's what he said in this article. That's why I highlighted it. So I was reading, they're like asking a lot of questions. They're like, yeah, there's a trial from Pfizer with 8 mice, and they're doing it this way where they have the old one and the new one, and some people are like, I get why they might do that, but I'm not sure if it's necessary. It's like, if science.org is this suspicious and this like interested in asking questions, I really just wonder what's going on. But I don't want to wonder too hard because I don't want to get my entire existence taken down by the big pharma operatives, the sneaks and the liars who work for this major corporation who controls most of the flow of information. So it is what it is. I take my own personal life in my own consideration of what I do, and I'm not even sure that I will qualify for this booster because this article seems to say that it's a booster and not for people who are unvaccinated. But fascinating stuff that the human trials are not completed, and they're referencing a June study with 8 mice. Let me know what you guys think in the comment section. I'm probably going to keep this video pretty brief and do some things this weekend. So God bless you. God bless your family. God bless America. God bless the world. Thank you for the experts in, government and media and big pharma who just keep us so safe. And, thank you to Rochelle Walensky, Joe Biden, and Rachel Maddow, who once told the public that, if you get the vaccine, it would block transmission and you couldn't spread it to another host. And, thank you guys for telling millions of people that and then backtracking and then somehow blaming everyone else for, not saying that and accurately reporting. It's weird when you are accurate, you get punished more than people just who lie all the time or make mistakes, whatever. God bless you guys. Just a few links real quick if you guys want to. Patreon.com/RareTalk. I appreciate that. That keeps the stream alive. I'm looking at new innovative ways of getting the information out there. Instagram and TikTok has been great. Obviously, I do 4 secret podcasts on patreon.com/RareTalk. So if you want more content, you can go there. Thank you to Facebook subscribers. We gave away 2 signed hats on Facebook to anybody that's a subscriber on there. I haven't mailed them out yet, but I will. Thank you to everybody signing up to my free email list. It's going to be in the YouTube and Facebook link. It's stayintouchwithme.com. So if you go to the top and write stayintouchwithme.com, you can sign up for my free email list. And I have a video that I'm working on to show that the fact checkers are psychotic and dishonest and they're not even good at their job. And I've been working on that, and it's taking me a while because I'm pretty busy. But when that gets done, I still will email that. That's going to be the next email I send. I won't send another email until that's done. And I want people to really see this one because it's important that we caught the fact checkers lying and being deceitful. So I know that Facebook won't show my whole audience and YouTube won't. So I will, email it to all the people on my email list at stayintouchwithme.com. Appreciate you guys. Have a beautiful, beautiful day. And let me know in the comment section what you think. But, don't think too hard publicly because these social media sites tend to hate it. Although I do think we're winning because the truth stands the test of time. And you're starting to see a lot of stuff start to come out. CNN is getting attacked by Dan Rather. CNN's getting attacked by Democrats because CNN realized, I believe, that being dishonest and lame and, fake all the time and just like bad at being honest, it doesn't build an audience. CNN has lost a lot of their audience, and now it seems like CNN's trying to be more moderate because CNN Plus failed and Brian Stelter failed. And now that they're being more moderate, it's funny that they're losing their old audience because the far left is too far left and they don't want the truth, so they're freaking out. It's pretty funny. It's like Liana Wen. She was big on forced masking, vaccination. She doesn't believe you deserve the same rights as everybody. And then a year later, once all the real data came out and she realized that her message wasn't really good anymore and it didn't make sense, she started backtracking, and now she has a bunch of people she brainwashed attacking her because she's not being crazy enough. That's what happens. You make people crazy, you lie to people for years, you push all this propaganda for years, and then when you finally come to your senses or it gets so obvious that it's not right and true, you backtrack and try to save your career and say, oh no, now we're going to be CNN that's bipartisan. Now I'm going to be Liana Wen that doesn't want to treat everybody like, nutty because they're not getting master vaccines. And, it's like the Frankenstein monster. What you built turns against you. So I'm not saying I wish for their audience to turn against them, but I do think that that's a good sign that people that have been the most dishonest and the most propaganda-y, for lack of a better term, over the pandemic, they're starting to flip-flop and backtrack, and all of these policies that they had are so obviously stupid, and people are starting to realize in mass numbers. So I think that's a huge great thing. And the sloppier and sloppier big pharma gets, eventually they're going to get bopped. They always do. The thing is, when they get bopped down the road, I don't know what's going to happen with Operation Warp Speed stuff, but, there have been in the past, I'm just saying, just like the Bayer thing, there have been so many things that they've got caught doing all the time. It's just they don't really care. So if they do get bopped, this is an example. I'm not saying this will happen, but let's just say in an alternate world, Pfizer or Moderna gets caught doing something that isn't right, like 4 years down the road, or the FDA or whoever. This is an alternate world, a fictional world right now. What price are they going to pay? Are they going to pay a price that's bigger than their profits? Almost definitely not. Is anybody going to be really held accountable to a serious extent? Probably not. Is anybody that was affected negatively going to get anything for it? Maybe, but it's like in some cases it's too late. So I'm not saying anything's going to happen. I have no idea, but this does happen quite often, and the business model is worth it for them. So it doesn't seem like they really care that much if you can make more money. Like, the amount of sales that Pfizer has made with the COVID vaccine, it's in the tens of billions of dollars. So it's like, how big would a fine be if they got caught? I'm not saying they will or they did anything wrong. I don't know. I'm just saying it's like, it doesn't seem like there's really big incentive for big pharma to not scam people sometimes, because if they do, they usually make out like bandits and create more money than they'll ever have to pay. That just historically seems pretty accurate for other criminal fines that they face. Appreciate you. God bless you. Have a beautiful day. And thank you for joining. And if you ever want the Audio Dreamer podcast, give me a 5-star rating on Apple and Spotify. I appreciate it. Thank you.